Hey, I just wanted to let you know what I'm doing right now. I'm in a weird spot here. But what I'm doing is I'm putting a point on my calf right on the corner of that bar. And the reason for it is because I'm holding pressure right on a nut because I feel like my calf is gonna pop. I haven't been training a lot recently. So by holding this pressure, there's actually a reflex inside of the body where when you hold pressure onto a muscle spindle, what it'll do is it'll actually relay to your brain and send a message back to your muscle that you need to inhibit the tightness. And so if I can get this muscle to stop being so tight, basically I won't tweak, the muscle will calm down and perform normally. So I'm just holding pressure right here on this knot. It's probably my soleus muscle, which is a push-off muscle, and I'll hold pressure for about 90 seconds. So we got about 30 seconds left. But yeah, use this if you're getting back into running and something pops up and you want to keep pushing and your body may not let you. So this is pretty helpful. I use this a lot on myself as well as in therapy when I'm treating soft tissues. So I just got home and sure enough, I'm limping. I can feel my calf kind of locking up a little bit. And I'm pretty sure it's my soleus because when I stretched with my legs straight, it didn't hurt at all. But when I stretched with my leg bent, I can feel it stretching on it. So what I'm going to try to do right now is I'm going to, the muscle is actually over on this other side of my calf. But what I'm going to do is I'm going to use this, it's called tack and floss or voodoo floss. It's basically a 2-inch band by whatever the hell width that is, about 7 feet long. I'm going to apply a bunch of pressure to kind of create a lot of compression, and then I'm going to go through and do some deep stretches on it and see if we can press and push that inflammation out. Even if I don't feel relief then, I'm probably just going to leave that floss on. I'm going to leave the wrap on, and I'll explain why in a second. So let's see how this goes. So once we're rubber on rubber, it sticks and we're good to go. And I gotta be very tight with this. Looks like I have chicken legs right now. Okay, so I'm wrapping the area. And the soleus is really concentrated high, it's not low. So I'm not gonna worry about going all the way down to the ankle. In fact, after that last wrap, I'm going to create a little bit higher compression. If you have enough, you could do basically a cross. That would be also good because you're applying a super amount of pressure right there. So now that I'm locked in, so what I'm going to do here, get down on one knee and I'm gonna move all the way, deep lunge into it, trying to basically create a pump to pump out the inflammation, also creating pressure on that muscle spindle which relays to the brain to relax the muscle. I'm actually feeling it considerably low. So a lot of times the muscle won't fail in the middle, it'll fail where it attaches to the tendon. So maybe in this case I should have gone a little bit lower. So what's my dog up to over here? Winnie, who's there? Winnie, who's there? Huh? Who is it, girl? Is there someone there? There's nobody there, mama. Anyway, so now that I've created basically the pump to floss out the inflammation, now I'm going to just basically wrap this band a little bit lower where I feel the tension. And what that's going to do is basically create like a new insertion point, so that when you go to activate your muscle, like when you're walking or running, basically instead of the muscle pulling on the tendon right here, it's going to pull on something that feels more integritous, if that makes sense. Almost like, let's say I have tennis elbow, right? But actually, these muscles, like the extensor carpi radialis, goes across the wrist and across the elbow to insert up here. So if we want to, let's say it hurts on the outside there, right? What we want to do is basically change the attachment. So instead of pulling on my lateral epicondyle, yeah. Basically, I'm going to change the insertion point and put it right here. And so I would wrap basically like a tennis brace here. So it's the same sort of thing that I'm going to try to do in here, right? I'm just going to give it some stability so that it's not pulling on maybe the portion of it that's strained, especially where that muscle inserts on the tendon. You can also do this for your knee. So a lot of people, when they have patellar tendonitis, they're going to do basically a patellar brace here. And what that does is it changes so that patellar tendon is no longer inserting on the tibial tubercle. It's inserting where the pressure is. That way there's no pressure that's going to be constantly pulling and pulling where the problem is. So that's something you can try if you do injure yourself, guys. Be safe out there. I wish everyone an awesome fall of exercise. God bless.